Welcome to the podcast. My name is Hamad Tariq and I'll be your host for today. Today we're going to be tackling a very important topic, first aid. And to talk about first aid, we have Mr. Anas with us today. He is a student of PhD. He's completing his PhD in about a year or so. Welcome to the podcast, Mr. Anas.
Good morning, everyone. My name is Anas. I'm a clinical instructor at Riyadh Ilm University, and I'm a student of PhD. I'm in the College of in the Department of Community Health Nursing. I'm a part of nursing college, which is titled as a Pharmacy, Nursing, Applied Science, Applied Medical Science College at Riyadh Al Ilm University. Nice to be here with you, and
Thank you so much.
I'm ready to help.
Yeah, thank you. We appreciate you for your time and thank you for coming to Saud. All right, so let's dive right into this. It's going to be divided into two sections. First, we're going to be asking normal general questions about first aid. Second, we'll be talking about situations. Okay, for example, if someone faints and this and that. All right. So briefly, can you explain what first aid actually means? Like, for example, like in medically or to non-medical professionals, like me, for example, like can you explain what does the term first aid actually mean?
So, generally, the first aid, simply, this is something we have to do
Mm-hmm.
before the professional people came
Mm-hmm.
to take over,
Mm-hmm.
or before we shifting the victim, let us say, or the person to the hospital or a medical facility, let's say. So first aid, actually, it is a very important topic, um, especially here we are at school. This age, especially the high school, let us say, they are very high risk for fall down, for injury, for different kind. Especially there is some people or some student, for example, they have certain diseases undiagnosed, or we don't know the medical background of them. So anything can happen during the school time.
Mm-hmm. For sure.
So first aid, whatever something happen, we have to be ready to do our intervention sequencely, smoothly, so we can save the life. Because as you know, a part of first aid, the crucial thing in the first aid is the time. Whenever you initiate the intervention very early, that means you save the life.
Uh-huh. So basically it's the first line of command.
Yes.
Okay, that's perfect. That's really nice to know. Okay, so for example, why is it important that everyone, including like me, for example, I'm a non-medical professional, or anyone should know this outside of the school environment? Okay, for example, like if someone faints, what should you do? Can you like elaborate on that? Like, why should everyone know this?
As I mentioned earlier, incidents can happen
Mm-hmm.
anywhere,
Mm-hmm.
in the bus, in the school, at home. Every one of us at home, we have old people, we have children, we have teenagers. Uh, so the incidents can happen anywhere. But we have to focus, especially, for example, in the schools. In the school situation, it's a little bit different. There is a more number of people. They are participating in some special activity, practicing some activity. So for the normal people, let us say, sorry for the, it's not,
Yeah, obviously, obviously.
but I mean the regular people, the non-medical people, let us say, they should know at least the basic thing,
Mm-hmm.
how to interact, how to respond, the basic thing. Because as you know, the first aid, let us say there is any incidents happen.
Mm-hmm.
So your part as a first aid responder, or someone know about the first aid, you will initiate or start your intervention. And a part of your intervention, you have to call.
Of course.
Have to call the 911 or the ambulance. So meanwhile, until the help arrive, this is your part.
You're the
This is
first
your
responder,
time.
basically.
Yeah, you are the
Exactly.
first
Yeah.
responder, and this is your part. So if you have the information, if you have the knowledge, you will act correctly, properly. Otherwise, we can lost alive, or the damage can be more serious.
Yeah. So, for example, if someone has a heart attack, you should know how to do a CPR and stuff.
Yes.
Okay. So, while we're on the topic of a CPR, can you like tell us how to do a proper CPR for a non-medical professional? Because I know there is a medical way and there is one everyone should know. So, can you like talk us through this, like how to do a CPR?
Yes, the actually the CPR, it is a very, 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 very important topic, and CPR, there is a step, or let us say sequence of the CPR. Whenever you find someone, for example, fainting or loss of consciousness, you have to approach the person safely. When you get to him, first thing you have to make sure he's responsive or unresponsive. So how we are going to do this? We have to tap on the person's shoulder, for example, and you can call him. Let's say you don't know him.
Yeah.
Yeah. Hey, sir. You have to tap on his shoulder hardly to make sure if he respond or not respond. This is the first thing. Second thing, you have, if the patient, if the person he is not responding, he is not communicating, the first thing you have to do, you have to call for help. So the people around you, they should know there is some emergency situation here. We need to come and help. Because of course you need someone to be supporting you. You need someone to handle you something. Yes. After you call for help, then the two important thing in the CPR, you have to confirm about them before you initiate your process of CPR, which is the chest compression. Let us say this is the main thing. You have to confirm if this person he has a pulse. That means his heart beating still or no.
How do we confirm that?
Yeah, this one we are approaching the person from the carotid area. This area we are call it the carotid. So in the middle here we have, this is the trachea. Here at the other side,
Yeah.
right or left side,
Okay.
we have to press and confirm if there is a pulse or no. Actually, to checking the pulse, there is a many different area in the body we can check the pulse.
There's one in your wrist
But
as well, right?
yeah,
Yeah.
that is the radial area, yes. But the most important area for the CPR we're checking here in the radial, you have to use your two fingers and gentle press in this area. So to find out if there is a pulse or not. If there is no pulse, this is the number one.
No pulse.
Number two, the airway.
No.
As you know, if the person he is unresponsive, so he cannot breathe by his own. We have to help him to open the airway. So the airway, we have two way to open the airway, but let us say generally we have to elevate the patient head a little bit, and we have to support from the jaw here to make the airway patent.
Okay.
Yeah.
Make sure there's no friction or there's nothing stopping the air.
Yes. And here we have to consider if the patient he has trauma or no.
How do we confirm?
As you know, for example, if the patient, let us say the road accident, the car accident.
Yes.
So here we are suspecting the person he has spinal injury, let us say, or something. So we don't know how, we don't want to move him until we confirm. Correct.
Yes.
If we confirm, if we move him, maybe we can make more damage.
Yes. Because spinal injury is a
Yeah,
huge.
spinal injury is very serious something, and there is a very serious side effect for it.
You can be paralyzed for life.
Yes, yes. So we need to open the airway. This is the two important thing. So the first thing, we approach the person safely. We find out if he are responsive, and then we check his pulse. Let's say the heart rate. That means if there is no pulse, that means his heart is not beating anymore, right? And the respiratory, we have to see if he's breathing or no. While I'm checking as we say, we use our two fingers in the here this area. So we have to look at his chest. If the chest rising up and going down or no. The movement of the chest, it means that he is breathing by his own.
Oh.
Yeah. So we have to do it one time. Checking the pulse, checking the heart rate here, and looking to the breathing, if he is breathing or not. So let us say in the bad situation, he is not breathing,
So you
and
do this.
he is not, yeah. You will keep the airway open, and then you will start the chest compression. Chest compression, it's very important to know. between in the middle of our chest,
Mhm.
there is area called sternum.
Okay.
So in this sternum, I will open my hand, the palm of the hand, this area here in the
Uh-huh. Mhm.
end of my
Palm.
palm. So I will keep this area in the middle of the chest,
Chest.
between the
Yes.
ribs,
Yes.
and then I will support it by my other hand.
And uh-huh.
So it will be like this. This
Mhm.
one it will be down immediately with just pressing the middle, and this one in this way. So you have to keep them attached together. So the pressure
Is
it
locked.
will be by the whole body, straight hands, especially here in the elbow. We don't want to decrease the pressure, because the
Mhm.
pressure it is
If you give a constant pressure.
yes. So you will keep pressing 30 pressure.
30.
Yeah, 30 you will count
30
while you
press.
are pressing
Mhm.
30 press. While you are pressing, you will count 30 until 30. 1,
30 compressions
2,
basically.
yeah, 3.
Uh-huh.
And there is a very important point between the compressions. We have something we call the recoil. We need, let us say, simply, we don't want to make the compression continuous. We need to give to keep a little bit gap between the
Oh,
compressions.
okay. What's the reason for that?
Yeah, actually, this is to allow the blood to come back, or to yeah, this is
Okay,
called
okay.
recoil.
That's new for me. I didn't
Yeah,
know this.
this is a very important point.
Mhm. If you don't do the recoil, it's not gonna work.
It's not gonna work. So here there is a very important thing about the quality of CPR. The
Mhm.
quality of CPR. This is the one thing of the quality of CPR. You have to press hard and fast.
Hard and fast.
Yeah, hard and fast. This
Mhm.
one we have to keep it. So while you are doing
Compressions.
the compressions, you have
Mhm.
to count one,
One.
2, 3 until you reach 30. So here we support the heart. Back to what I mentioned before, we have the breathing, right?
Mhm.
Because still the person he's not breathing. So in the breathing part, we have to, after we complete the 30 compression,
Mhm.
we have to open the person mouth. We have to open this person mouth, and by my own mouth, I have to give him 2 breaths.
If he is not breathing.
If he's not breathing,
Uh-huh. Even after the CPR, after everything, if he's not breathing.
yeah, this is the
Second part.
complex, something complex.
Uh-huh. Yes.
After 30, immediately you have to give 2 breaths. So
Mhm.
we have to remember it like this: 30 pressure,
Mhm.
or just compression, and 2 breaths.
If the 30 compressions don't work, then you move to the mouth to mouth.
No, the mouth to mouth breathing, this is to give him because see, when we approach the victim, first we check 2 things. We check the pulse,
Mhm.
the same time we check
The
the
breathe.
respiratory rate.
Okay.
So if he is not breathing
Uh-huh.
by his own and there is no pulse, that
You need
means,
CPR.
yeah, we have to do CPR
Uh-huh.
for the heart, and we have to give him
Air.
breath.
On his.
Yes.
Okay.
So we will keep doing like this until the help come.
Mhm. All right. All right.
Yes.
That's really nice.
Yes.
Thank you for that. All right. So I want to talk to you about the first aid kit. Okay, I've heard this since growing up. First aid this, first aid that, first aid kit is supposed to have this, this, this. What do you think, or in your opinion, what's the minimum a first aid kit should contain? I know there's supposed to be band-aid, I know these common things, but at minimum, like what every first aid kit should have.
The first aid kit, it is a very important, and the good thing now, if you can notice, wherever you go to the market or any place, you will find the kit
Yes.
everywhere, and this is a very important. So the first thing in the first aid kit, we have to know what is first aid doing for the certain procedure. For example, uh, injury is coming. It's happening anywhere. For example, let us say here at school, a fall down, a fracture, injury. So the first aid kit, it's especially here, I think in Saudi Arabia, everywhere you go, you will find the same kit. It's, let us say, it's unify the content of the kid. It's unified.
Internationally or just in Saudi?
It should be internationally, it is unify, but the content is different.
Some
from
things are changed here
yeah,
and there from
but
region to region.
but the major thing, it should be included. For example, we need the bandage. Where we use the bandage for example, if there is a
The
cut
cut,
surgery, bleeding, the first thing we have to do in the bleeding, we have to press, right? So to cut the blood supply, so to decrease the amount of blood coming out of the body. And other thing, the bandage, we can use it for the other thing, for the pressure, and for the, for example, if we have fracture, if we have fracture in the bone, that means the bone, it's, or dislocation in the joint. For example, the joints in the body, it's attached in certain way. Sometimes in the fall down or in the any kind of injury, dislocation is happening, for example. So the joint is not
intact and
attached, yeah, in the normal way. So this time we have to do support also with something hard and
bandage or
with the
something.
bandage. Yeah. The other thing, solution for cleaning, because
Disinfectant
yeah,
basically.
disinfectant. Let us say, yeah. So, for example, in the fall down, let us say here at school, for example, there is any fall down or injury on the floor. So the first thing, we want to avoid the infection of the wound, yeah, which is contamination of the wound. So we have to
Yeah.
clean it with any kind of disinfectant, like as you mentioned, betadine or something. Yes.
Okay, that's really nice. Do you think in school every class should have this first aid kit, like every single class? And also, do you think that every teacher or every like person in school, like someone older, for example, should be taught how to do first aid and how to use these kits?
Availability of the first aid kit, it's depend on the area.
Mm.
Basically, the classes here, there is, let us say, each class, in each class there is like 15 or 10 or 20. So as I mentioned earlier, the injury can happen anytime, anywhere. So presence of the first aid kit, it is a very important, and it should be mandatory in each class. For example, if I am in class A and I don't have first aid kit, and I have one of my student, he fell down, he has injury or something. So do I have enough time to call from any other department or any other classes to get the first aid kit?
Obviously not. So
So this is the time, as we mentioned earlier, time is very
time is
crucial.
pretty important. Yes, yeah.
So I think, from my opinion, each class, they should have their own first aid kit,
Mm-hmm.
and the teachers should be trained how to perform the basic thing. We don't want the complicated thing, but the basic thing. If there is injury, we have to clean it. We have to do pressure. We have to avoid to decrease the blood loss. If there is a fracture, we have to support the basic things. At least you can save something before it get more worse.
Okay. So staying on the topic of school, what if, for example, we're playing PE, all right? Or out of school, you're in the gym or anywhere, all right? You're doing physical activity, all right? What if someone faints? What should you do? What should I, as a person, should do, or anyone should do if he sees a person faint while performing a physical activity? And what do you think are the causes, like main causes of him fainting, of her fainting?
Uh, the fainting, it's a sign for something, or indicator for something else happen,
Yes.
so that the body collapse
Yeah.
or faint. For example, let's say in the PE class, one of the student faint.
Yeah.
So doing the effort, and that means you are burning calories.
Yes.
Yes, and you are losing some water of the body, which is the sweating. So most of the things, first thing we have to do, if we have someone faint, first of the thing, we have to keep this person safe or move him to the safe place, because falling down, it can happen anywhere. over the chairs, if they are playing, for example,
Yeah.
outside in the field,
Of
anywhere.
course, yes, anywhere. You can
We
faint anywhere.
Yes, so we have to make sure this person he is in the safe place. And then the other thing, the school they should have like let us say the health record for any all the student.
Yes, yes,
Yeah, because fainting could be from hypoglycemia, which is a low blood sugar in the
yes.
body, right?
Mhm.
And it can be from loss of the excessive sweating by exercise. It can be some kind of shock we are calling the hypovolemic shock, for example, loss of much fluid from the body. So if we have the information that, for example, let us say if this patient, this student, he's diabetic,
Mm,
he has blood sugar, for
mhm,
example. If we know, we have to act correctly. For
mm.
example, we are not going to start the PE class before they have their
Food or anything.
meal.
Yes, yes,
Yes.
yes, yes.
So if there is a high blood sugar, we should have the insulin. For
Mm.
example, there is some students they have insulin.
Yeah.
So basically, we have to keep the person safe, and we have to if there is a loss of the fluids or decrease of the blood pressure, for example, most of the thing happen because the hypotension or decrease of the blood pressure. Why the blood pressure decrease? From the excessive sweating, and he's burning a lot of calories. For example, he didn't took his meal. So in this situation, we have to elevate the legs of the person up.
So this is in general, yeah.
In general,
Uh-huh.
yes.
Yes.
Why we are elevating the feet up? Because the blood is going
To the
down. Yeah,
Mm.
so the circulation it will be better in the brain. Yeah.
What's the science behind this? With the blood going to the brain, how does it like wake a person up? I don't understand this.
It's not about waking. It's we don't want, for example, if the person faint,
Mm-hmm.
the circulation, it's going all over the body until the extremities.
Yeah.
So that means the amount of the blood is going to the extremities. I need it in somewhere
Every
important.
help.
Yeah. So when you elevate the lower limb, that amount, the high amount of blood is going to the extremities. He will come
Mm-hmm.
back
Back to the
in.
heart and then
Yeah.
okay, okay,
Yes.
okay. So staying on this topic of fainting and stuff, how if for example if I find someone unconscious, all right, and I don't know anything about him, okay, how do I know he has fainted due to low blood pressure, due to low blood sugar, or any other causes? For example, like let's say I go to the library to study, all right, and I find one of my friends or someone, I find anyone, he's fainted. Okay, and I don't know anything about him. And one thing about diabetes is that you don't know if you're diabetic unless you get tested. If you don't have a doctor at home, right? So how do I know that this person has fainted because he has low blood pressure, or if he or it's due to low sugar levels? How do I know? Like, and how do I help this person?
It's not easy to know for you. For example, as you mentioned, they are sitting in the library, as I said, and someone faint. It's impossible to know what is the reason of fainting. But as the first responder or someone closer to him, you have to make sure you have to do some important steps. First of all, uh, as we mentioned before in the CPR, you have to make sure and this person he is alive. He has pulse, he has heart rate, he is breathing.
He's not sleeping and
Yeah.
he's not breathing at all.
Because
Uh-huh.
as I told you, we don't know what is the reason behind this faint. So I have to try to wake him up.
Yes.
If he's not waking up,
Mhm.
I have to check his pulse if there is a heart rate, the way that we mentioned before, and I have to look he's breathing or not.
By
If he
chest
has
or anything.
Yeah, if he has pulse, there is a heart rate means, and there is a breathing, it's okay for now.
Mhm.
And then I call for help already, right? So until the teachers came, until the I think most of the school they have
We have a nurse.
a nurse or something. Yeah. So they have their record, they know their student ID, they know their history, and they will act accordingly. But as the first responder you mentioned, you have to make sure
The person is alive
he's
and
breathing, he has a pulse, and then you will call for him.
So you don't do anything by yourself. Like you
Nothing.
just check if he's alive or if he is awake. I mean, like if he's breathing and he has a pulse.
Yes.
Then you call someone to help you.
Yeah.
All right, that's really nice. All right, so now that we have moved, now we can move on from this fainting and unconsciousness. All right, so I want to talk to you about like choking because it's a really big issue. For example, with kids because they just gulp, 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 and then it just gets stuck. Right. So if a child suffocates, okay, by inhaling a foreign body, okay, how do you respond and like what will you do? What should a person do, or what should a teacher do?
Choking, as you say, it's happening, especially in the school. Very high risk.
Yeah.
Choking,
Yes.
especially.
Because these kids they will be playing and they'll be consuming food, which is very wrong.
Yeah,
Mhm.
you're right. So, choking, what is the meaning of choking? That means the airway obstructed by something.
Of course.
For example, a toy or
Yes.
a food or something.
Mhm.
So my goal here to be, I have to remove this particle out of him.
Mhm.
So in order to open the airway, I have to remove this particle.
Mhm.
Say, so there is different kind of maneuvers we are doing in case of choking. Let us say here in the school, for example, if one of the student choking by food or something, so I have to come back behind the person, and I have to not tapping, but I have to apply some kind of pressure on his back to
Remove the thing.
yeah, to help him
Mhm.
to do some kind of to take it out. So
Because the air pressure will build up and cause it to come out,
yes,
right?
yes. So in case this one is not working
Yeah.
and he's unable to remove, so I have to come back from his back,
Mhm.
back of the person, and hold him from the back and do pressure here in
Stomach.
the in the stomach.
Uh-huh.
So this pressure in the stomach I'm applying, it will make this area high pressure, so it will help him
Uh-huh.
to take it out.
Okay, so you can do this with anyone or just for kids?
No, the adult people we are
Uh-huh.
talking here, but the kids they have another kind of
How
maneuver.
can you
So
elaborate?
I mean the infant, which is
Mhm.
happening,
Kids, infant, anything.
yeah,
Yeah.
in the house. We have the goal of this process. We have to apply pressure in the stomach and pressure in the back of the baby. So we will hold the baby like this, the abdomen, the belly of the baby, it will be like this, and from the back of the baby, I will apply pressure, so it will help him to take it
Mhm.
out.
And this procedure is from what age to what age do you do this? For example, from infants to how many? Like how old?
Actually, when we are talking about infant, let's say until 1 year, uh, I can apply this kind of maneuver on uh,
Baby, child.
the baby.
Yeah, yeah. And after 1 year, what do you do?
After the 1 year,
Adolescents.
we will apply this kind of
Uh-huh.
pressure.
So this
Until the
process
adult.
is this process is only till 1 year old. Once your child is more than 1 year old,
Yeah,
you do this other
we have to
process.
do pressure. We
Mhm.
have to hold the person in front of us. We have to do apply
And
pressure on
yeah.
the.
All right, like you said
Yes.
before.
Yes.
Uh-huh. So also, if like for example, if there's a art class in school, not an art class, if there's anything, all right, in generally, for example, and someone has a major cut on his arm, all right, and there's excessive bleeding due to that cut, all right, what should a person do for that?
So, in the case of bleeding, I have two main thing. I have to keep them in my mind. First thing, I need to decrease that blood come out from the person. So, the more the blood loss, the more the
The worse it
person
is for you.
worsening or faint or loss of his consciousness. The other thing, I should keep in my mind, try to avoid contamination of the wound, of the cut area. So if for example, if in the any class and there is a cut, first thing I have to apply the pressure from the source of the bleeding. For example, this is a wound. I have to bring something clean, whatever I have. That's why we mentioned before we have to keep a first aid kit in any class. So I will bring some
Like a band.
gauze or yeah, or anything. or even let us say outside, we don't have a first aid kit, some clean clothes, we have to do pressure on the same area. I have same area of the cotton, so I have to keep this pressure for a long time, as much as I can. Hard press, one press. I will not press and remove, press and remove. No, I will keep the keep pressing on the area of the bleeding until let us say 5 to 10 minutes. One press. It will help the clotting factor
To
to
start.
build up here in this area, yes, and to decrease the amount of bleeding coming out.
Mm-hmm.
So the major two things: avoid excessive bleeding or loss of the blood by pressure, and keep the area clean by using something clean, gauze, for example, bandage, or even clean clothes.
What's the science behind the clotting factor needing something to cover it? Like, can you explain, like, for example, why do I need to cover it? Why didn't it just start by itself?
Here, the idea behind the pressure, not the cover.
Uh-huh.
While I'm covering, while I'm pressing the area for whole 10 minutes, one pressure, and it will help the body to build up during this time, 5 to 10 minutes, build the clotting factor in the area of bleeding.
Because I feel like it's because it keeps the blood pressure. Or no?
No, no, it's not related to the blood pressure, but I mean, if you are pressure, or
Mm-hmm.
if you are applying pressure on anything, for example, if you are making something glue or something, you have to keep press for a long time. So the same for the body. If you are applying pressure on the area of the bleeding for whole 5 to 10 minutes, for example, one press without lifting your up your hand, so it during this time it will help the body to build the clotting factor to stop the bleeding, or at least to decrease the amount of bleeding, blood coming out of the body.
Uh-huh. That's really important. So you should always maintain pressure first.
Yeah.
Okay, and maintain pressure and then look for help.
Yes.
Okay. So this is not part of first aid, but I want to ask if, lasam Allah, someone gets stabbed, okay, from the movies, okay, this is not from me. I've seen that they don't say, oh, keep it in, keep like the knife or whatever
Or the
inside.
object. Yes.
Yeah.
Yes.
So what do you do like in a realistic situation? Not in the movie, not like Hollywood. What do you do in real life? Lasam Allah, someone gets stabbed.
It is a right. Actually, it is a right.
Really?
So, yeah, let us say, for example, uh, stab wound by a knife, for example.
Yeah.
When this knife enter the body, you don't know which artery or which vein cut it by this knife. So the same thing if a pencil inside the body, inside the eye, for example, or any foreign object or sharp object enter the body. So my point here, as I mentioned before, we don't want to lose more blood.
Mm-hmm.
So removing the knife means that area locked or closed, that vein or artery locked or closed by the knife itself.
Gush blood out.
Yeah. When you remove the knife, the blood will come out.
As they come at a
So,
high pressure.
yeah, until the person reach the hospital or
You
the
don't
any health
have
facility, don't remove anything. Yes.
Uh-huh. So it's just to like do not let blood loss, not let blood
Yes.
loss. Uh-huh. Okay, okay. So I just have a question. When you get burnt at home, okay, your adults, for example, your grandma's gonna say, put some toothpaste, do this, do that. Is this like is there a science behind this medically, or is this a myth?
No, no, no. Actually, the burn itself, there is a degree of burns. Not
Mhm.
all the burns same.
Yeah, I mean like the
Let's
ones
say,
at home where
yeah, yeah. Let us say the normally. You are not allowed to apply any kind of toothpaste or some even random creams.
really.
No, yeah, yeah. You don't have to apply anything. There is no any scientific evidence that the toothpaste helping to.
Wallah,
Yeah,
really?
yeah, yeah, yeah. It actually it's not scientific. It's
Uh-huh.
something that the people use
Just do
to. Yeah, but professionally, and there is no any update or research is telling the toothpaste can heal the.
Oh, really?
Yeah.
So what should you do when you get burned?
Actually, burn, it can happen in the house, in workplace, in somewhere. So the goal of the burn, it is the same like what we mentioned in the bone, in the wound. We don't want this burn area to be infected. So if we have first aid kit, of course we have that normal saline. Yeah. So we will just wash it with the normal saline. We will take the person to the near facility, health facility.
And what if this facility is not nearby? Can you put like ice or something? Like first thing you do, if
First thing, keep it clean.
keep it clean
Yeah.
using any
But
silent.
applying the cream, we don't know this type of cream or what this cream use. It can make the wound or
Worse.
the burn worse. Yeah, it can. Maybe he's allergic for this cream. Maybe this cream is using. It's not contain any antibiotics. Not contain anything.
Yeah.
Yes.
But then why does applying toothpaste work? For example, last year I got burn in my hand. Obviously, my mom being my mom, she got obviously
Apply.
she used toothpaste and everything,
Uh,
right? So like, why did it work?
it's working. It's working.
Yeah, it
for,
works.
for,
Yes, yes,
for,
yes.
for many people.
But medically, it's not a proper
But
thing
scientifically, you cannot advise the people
to do the.
apply
Mhm.
this one.
Mhm. Can you talk about the degree of burns? Like, what's the first degree burn? What's the second degree burn? And what's the third degree burn? And how to identify between each?
Generally, the burn, the degree of the burn depend on the deep of the burn, or let us say the layer have been burned. For example, the superficial skin, the upper side, the outer side of the skin, if there is a burn, this is the first degree. Much you get deeper to the tissue until going down the fat layer, the tissue. Yeah, this is the depend. This is it will indicate the degree of the burn. But as I'm a normal person at home, my goal to keep the burn area clean, whatever degree it was, it's not an issue. But I have to keep it clean. If I have normal saline at home, I have to make it. I have to wash it with the normal saline and then take the
And if you
person.
don't have saline, if you don't have
You can apply water. You can clean it with the normal water. Just my goal.
keep it clean.
Yeah, my goal to keep it clean until he get to the hospital and they will apply or they will clean it the right way.
Okay, so you first things you do is keep it clean,
Keep it clean.
and then look for help.
Yeah, this is for the wound,
Mm-hmm.
for the cut wound,
Mhm.
for the burn itself.
Okay, that's really good.
Yes.
All right. So how does a person deal with like fractures? For example, let's say someone is playing basketball, right? He falls down, he breaks his arm. Anything can happen, right? What's the first thing that you should do? What should a teacher should do, or what's the first thing I should do? What's the first steps?
The fracture, there is many different kind of fracture.
Mm-hmm.
For
There's the hairline,
the complex fracture. Yeah, there is a hairline fracture. There is a joint dislocation. This is mainly it's happening in the uh, PE classes.
Yeah.
Playing or something. So the as I said before, the fracture when happening, that means the normal structure of bone affected
Mm-hmm.
by fracture or by vertically or horizontally, let us say, and or the joint dislocated from the normal place. So my goal as a first responder, I have to support the area. For example, if I clearly I know this person he has a fracture here, for example, let us say here in the arm. So simply I don't know how what is the type of fracture and but there is something we call splint. Splint that mean simply any hard something, any for example a piece of wood or something.
To support it.
Yeah, or ruler, let us say.
Really?
Yeah, I have to put it and I have to roll the bandage around it. What is that doing? That means support this fracture. It's not getting worse. If the something, if the person is moving or something, the fracture it will stay steady like this,
First.
and I have to hang it to support. For example, I can use any towel or something. I have to keep it elevated and support it until we get to the
So you
hospital.
make a cast at home, basically, kind
Yeah, this is the splint is we can consider it kind of cast, but it's temporary.
temporary, just for now.
Yeah.
Okay. So how does a person know he has a fractured arm or he has fractured himself? Like how do you like if I fall and I get up normally, I'm like, yeah, I'm fine. But then how would like and then I get it checked and it's a fracture. But initially when I fell, how would I know I got fractured or there's something wrong with my arm? But it's like I don't feel anything. You get me?
Yeah. Actually, this is one depend on the severity of the pain. The second thing, the normal structure of the area of the hand. For example, this is the joint. I can move it like this in the normal range of motion movement,
Yes.
right? So if I'm unable to move this joint, and there is a very severe pain, for me, this is the indication of something worse happen here. So I have to fix it, keep it steady. I don't want to
Move it
cause more
again. Yeah.
damage.
Okay.
Yeah, so I will keep it straight, apply a splint as we mentioned, and then you can move to the hospital. So in the hospital, they will
They have
do X-ray or something
Yeah.
to confirm.
So first thing you check if you can move your arm
Yeah,
like this, and if you cannot, there's a big problem,
yeah,
and you keep it supported like this.
support it. Yeah.
That's really informative. All right. So I guess that's it for the first aid. There is not more you can do.
Yeah.
Like if you have a headache, just take a Panadol.
Yeah,
Yeah.
actually, always seek for help. Actually,
Don't do anything by your head.
don't use your mind. Don't do just know the basic things.
Yeah.
Whenever you have wound, keep it clean
Mhm.
and avoid loss of the blood. And if you have any fracture, just support it and go to the hospital. And always call for help. Even if you suspect, you are not confirmed. It's okay. Call for help.
Exactly, because health is something you don't joke around with.
Yes,
It's something you don't use your mind if you're not a medical professional.
for sure. Yes.
So, okay. So what's one to just finish it off, right? What's one advice you would give to everyone watching this video with this podcast or listening to this podcast? And what would you tell them to do, or one advice you would give regarding first aid?
First aid, from my point of view, I think it's something to be learned by everyone. The mother at home, the teacher at school, the bus driver, the police, everyone should know because we have one, two, three basic things. If we did it properly, correctly, it can save a life.
Okay. So everyone should know first aid.
Everyone should.
And don't use your mind.
Yes.
Seek for help.
Yeah.
All right.
Always call for help.
Always confirm. All right. That's it, I guess. Thank you so much for coming to the podcast. Thank you for your time. Thank you for answering every question in detail. It was very nice to know this and the information regarding the CPR and what to do. Very informative of you. Thank you so much. Very kind of you. Thank you for coming.
Thank you so much.
Thank you for watching this video. Hope you guys enjoyed. Please like, subscribe, put your notifications on. See you guys in the next one. Goodbye.